A very warm welcome to all. Let's get back to our next chat show where we will be discussing about the unseen heroes of healthcare. The one who do the diagnosis in the lab and saves lives, the clinical biochemist. Behind every crucial treatment, every accurate diagnosis and early diagnostics, it is one thing is common, that is the lab test. And the clinical biochemists are those unseen heroes, the experts who does not only conduct the lab test but save lives. And we are fortunate today to have one of the renowned clinical biochemists with us, Dr. Debapriya Bandyopadhyay, the additional professor AIIMS Bhubaneswar. We are really thankful, sir, for taking out time from your busy schedule and giving us the overview about the clinical biochemist. Welcome, sir.
Thank you so much for having me here.
So, for our audience, we would love to know from the streets of beautiful Kolkata, how was your dream has come that you will become, you take the medical field or healthcare as your profession, and how was your MBBS in JIPMER, and then how you actually thought, and when you actually thought you will choose clinical biochemist as your specialization.
Right. So for just like for any small child, there is always somebody who inspires to to become an engineer or a chartered accountant or a lawyer or a doctor. For me, it was my maternal grandfather, and he was a famous surgeon in Kolkata, and he was very revered by everybody in our family. And also, he had a very big rapport in Kolkata among the doctors, and he was my inspiration to become a doctor.
So it is always there in the family that medical is something which you are all introduced at your childhood itself.
Yes. So I aspired to be a doctor, and I worked very hard for it. I got a chance to study in one of the best colleges in Jawaharlal Institute of Postgraduate Medical Education Research in Pondicherry. It was one of the best experiences and the best time I had in my life.
Absolutely.
Very good training there. And after having finished the training, I always wanted to develop a laboratory kind of career. And it was given a proper shape by my guide in BHU, where I did my master's in medical biochemistry, and I did MD in biochemistry from AIIMS BHU under Professor Debapriya Das. And it was one of an experience to develop the skills and know-how of how the laboratory tests are done, about the angles of research, about the angles of teaching students, and as they enter as a student and they go out as a full-fledged physician.
Great. So, as we all have seen in the society, the doctors like cardiologists, the gynecologists, and other specializations, they are being given more appreciation compared to the clinical biochemist who really does the major part of their diagnosis, helping them. As I have earlier mentioned, that unseen hero or the heroes who are behind the scene, have you ever felt like that you are not getting the kind of attention that you as a profession, the biochemist, should have got?
See, as a person chooses a medical super specialty, the person chooses the life which that super specialty brings along with it. So therefore, if suppose somebody chooses to be a physician, somebody chooses to be a gynecologist or a doctor of the skin or a psychiatrist or a medical biochemist, then it comes along with the type of lifestyle which that person would be having along with the career.
True.
So therefore, when I chose to become a lab person, I definitely understood that I will not be having a direct patient interfacing, but then I wanted it that way. I chose my career to be that way, and I am perfectly all right with it.
And you're very happy and proud about
Of
it.
course, I am. I am
So,
totally satisfied with my career.
Can you recall any moment in your vast career where some incident has happened and some lab test you have conducted which you really feel that has made a great impact, and you are really proud of the fact that you have chosen being a clinical biochemist?
Yeah, of course. There was one of these patients who uh, who had to undergo a surgery. The surgery was an elective surgery, but then there was a screening thyroid screening to be done because the anesthetist had suspected that the patient is suffering from hypothyroidism. But on that particular day, the we had only one analyzer for immunoassay testing in our hospital. So that particular day, this analyzer was down. So the patient had given a sample to some outside lab, and it came as normal. So the patient was taken up for the OT. But then, even then, on the next day, when the patient was almost going to be taken up for the surgery, the anesthetist still had a doubt, and he sent the sample because by then the analyzer was actually working in our lab. So the sample was sent, and the patient was found to be overtly hypothyroid. And luckily, the sample was sent because of the clinical suspicions of the anesthetist that patient's life would have been really in danger if, without the diagnosis, the patient would have undergone the surgery.
That really proves the point that the lab test actually saves lives.
Yeah, of course
So
it does.
if there is a reliable and accurate diagnosis there,
Yeah.
then only a proper treatment can be initiated.
Yeah, in the age of evidence-based medicine, when everything we do, everything we decide, and all clinical judgments are based on some kind of an evidence, we really are dependent on radiology, we are dependent on histopathology, we are dependent on the biochemical testing, and these are actually the backbone of a clinical decision making, and they also support the decision in case it rolls down to a medical legal case, or if the thing goes bad, then the doctor's decision is supported by all these developments and all these findings in the lab.
Absolutely. So in that perspective, if I say, as per your experience in the past decade, how do you see the clinical diagnosis is shaping up, the technological advancement, or the way the perception is going, and all about the clinical biochemistry as a discipline, how it is progressing?
Yeah, the clinical biochemistry per se has expanded like anything over the last 10 years, because when I was a graduate and then a postgraduate, the scope of the clinical biochemistry was just limited to some biomarkers, some serum markers. Now it has gone beyond that. So there are precision diagnostic tools like DNA based tools or specific markers which even the physician should be using nowadays to tailor the medicines specific to the patient. So therefore, it has gone one realm, which is totally one different era now, where clinical biochemistry is not only deciding on the patient's diagnosis, but it's totally dependent on the patients. Even the treatment is being planned based on the specific nutritional analysis and other specific changes in the person's genome, and therefore the diagnosis is very important and based on the clinical biochemistry's findings.
Absolutely. So, as a clinical biochemist, how do you see that the centralized testing facility has been the core for so much of a decade? Now, the trend is shifting towards the point of care diagnosis. There are certain pros and cons in the centralized facility as well as in the point of care. So, how do you take this? Whether taking point of care as a kind of a next thing, do you support that idea, and if yes, what is the reason, and if no, what is your opinion on that?
See, the point of care testing facilities were not being so much accepted in the medical fraternity because of its poor standardization. Nowadays, with the development of various kinds of technology and the standardization of kits, which can actually give very good results, almost comparable to the fully automated analyzers in the lab, it is actually a very dependable way. And of course, there is an advantage of getting the patient's results in minutes rather than in hours. So therefore, there is a very quick clinical decision making, which cuts down on the patient's time in the
Right.
hospital, and early discharge. The patient can go home very fast with a quick decision making, and even the treatment can be initiated very fast based on the quick clinical decision making. So therefore, point of care testing is the future, and only thing that was plaguing the more widespread application was poor standardization, which we are trying to overcome with the advancement of technology and coming in of various kinds of kits which give a very good result, almost comparable with the fully automated analyzers.
Okay, great. So now one questions that is different from the technology, the myth or the misconception in the society. Many people think that this the kind of test that has been prescribed to them is something maybe a 10% of it is required, and doctors are generally prescribing so many tests, I might not be requiring it. And many a time people generally skip few of the tests. They prefer not to come to the doctor again. So what is your opinion on that, or what will be your message to them?
See, there are a lot of dynamics, and you have to really understand the various aspects of that. One aspect, of course, is the economic aspect. Some people may not be able to afford all the tests, so they might be going to the lab, and then they will be finding out which is the more expensive test. Can I exclude that? Can I just do with the rest of the test which I can afford? That is one part. Second part is, when a patient is, attending more of Googles, they do Google, and they become aware of lot of information which may not be very reliable, and then they decide on their own that, okay, this test, I think it's not relevant to my conditions and my diagnosis, so therefore why should I get it done? I think the doctor is prescribing it out of nothing.
So
He
you
doesn't,
mean
he's not very confident.
they start trusting Google doctor more than the real doctor?
Yeah, because some of the tests might be a bit expensive, so
Yeah.
they might start thinking that way, that okay, I can save some money by not getting this test done. So that is one part of it. And the third part of it is that when the patient is going to get the test done, and then they find that I have got it done just some time back, why should I get it done again?
Yeah.
Or maybe when the doctor is not sure, because the clinical condition of the patient is not really matching with the report, then the doctor might suggest, okay, you get it done once again.
Yeah.
And then the patient might thinking, why should I get it done again? Is that really necessary? So these are three perspectives which patients come and they do not get this test done, though the doctor might be actually prescribing, having something in their mind. So therefore, it's very important that the doctor also should take the confidence of the patient that, okay, I'm going to prescribe this test because of these things.
Yes.
And the patient also should have confidence in their physician and should get the right test done at the right time.
So you mean that there should be a clarity that
Yes.
if a test has been prescribed, it should also be explained to the patient why it is vital, why it is important. Then
Absolutely.
only he will be also able to understand the relevance of the test.
Absolutely.
And why it is important for them, because at that point he is considering the money that will be get that for the test it has to be spent.
Yes.
But if he spend that money, he might be saving the larger expenses that
Yeah.
he might have to take if it is not diagnosed at that point.
Yeah, you cannot really put a money to the health conditions, because if the test is not done, the disease got undiagnosed, then it's a huge amount of problem that the patient might be having, which could be prevented by a right timely diagnosis. Yeah.
So, Dr. Debapriya, according to you, if you have a young daughter, okay,
Yeah.
so if you consider to explain biochemist to your daughter,
Yeah.
in a very simple language, so that she understand and appreciate what it is, how will you put it across?
Yeah, I have been trying to do that recently. So it has been a real time practical experience, I think, when I have tried to explain that I'm a doctor, but I don't see patients. So it has been quizzing her that then what kind of work do I do? Well, I have been explaining that, okay, I have been working on certain ways in which the diagnosis of patients is done other than directly seeing the patients. So that's the first thing which I think a small child should understand, that how this thing works. And then as with her age or with his age, when the child grows, then they'll be coming to know that there are different biomarkers, the different parameters in the blood which can be tested to diagnose some diseases. So that's how the thing slowly gets understood by small children.
Very nice. So, if you have to pass on inspirational message
Yeah.
to those young kids who are aspiring to be in the medical profession, if you want to tell them ki, clinical biochemistry is one of the interesting subject where you are just not conducting lab tests, but you are saving lives.
Yeah.
So, what would be your message to them? So,
Yeah. So see, at the end of the day, what as a physician or a doctor, a trained doctor aspires to do is that that person needs to do good to patients. So therefore, if that is the primary goal of any doctor, then becoming a clinical biochemist is one of the very good options that they should consider. Uh, the reason, one of the most important reasons, is that if you are doing a diagnostic test and you're doing it with full dedication and understanding what has gone inside the testing, so that you can give a very good report to the doctor, to the patient, and helping the doctor to give a good diagnosis, an early diagnosis to the patient, then it's not only helping out the patients or the doctor, but it's actually doing a very big community service as well. So therefore, I think if somebody is aspiring to become a medical professional, a doctor, a nurse, or a healthcare professional in any aspect, then I think clinical biochemistry is one of the very futuristic divisions to go into.
Wonderful, wonderful. Actually, see, when the motivation is to serve the people, to be a part of the medical fraternity where you are doing a meaningful contribution, clinical biochemistry is one of them, where you are not just seeing the patients. It is beyond that. You are able to take the sample and do the test, and what is not visible to the eyes, you are able to detect those things with the tools and your expertise. So clinical
And it would be very wrong to say that we do not understand medicine, because unless we
yeah,
understand
of course.
metabolism very well, we will not be able to interpret the reports, we will
See,
not
it
be
is
able to
it is
give
just a
reports.
specialization,
It's
because
just a
you have done the
specialization.
MBBS. During
Yes.
this MBBS, every student is being given the same curriculum. You
Yeah.
have the absolutely the entire
Yeah.
knowledge about the
Hmm.
medical field.
Hmm.
It is during the specializations you chose to do the clinical biochemistry
Yeah.
part as additional.
Yeah.
Right. So it's wonderful talking to you. I am sure that the audiences would be helped by the comments that we have received, and various myths and the various misconceptions that we had, and especially for the students and the aspiring students who are trying to go to the medical fraternity, it's been an inspiration, and then they can start thinking about it, what should be their specialization, and now most of the people would start appreciating the fact the lab saves lives, and these experts are the unseen heroes which are behind the scenes, are actually saving us by giving the vital information to our healthcare providers, our doctors.
And there are two more, sorry
Yeah,
to
yeah,
interrupt
no,
you.
absolutely.
There are two more aspects of it which as a clinical biochemist we do on a day-to-day basis. One of them is the teaching of medical students, because these are the doctors of tomorrow. So we
Yes.
have to train them and make them strong in knowledge and skills and attitude. And the second aspect is the research. So we, along with the patient care services and the teaching, the third leg of this entire departmental, or you can say the objective of this whole institute, is research. So therefore, it's a very good area of work where clinical biochemist can do a patient care, can do a laboratory service, can do a teaching for medical students, and also do cutting edge research. So therefore, this is a very good career, and anybody who has the opportunity to get into this should definitely opt for it, and it has a very good potential for tomorrow.
Wonderful. So, though it is primarily been asked, rarely been asked to most of the time with to the males, but I would put this question over here. As you have mentioned that lab work is there, teaching is there, research is there, and your family is there. How do you strike the balance with so much of things on the plate?
See, that's totally a personal perspective. I'm sure there are professionals of any different, from IT section, from lawyers, from judges, from any other profession, and it's totally a personal way of managing your time. So
Exactly.
therefore, there are people who cannot manage their time well, and therefore they get stressed out. There are people who can do that, and they do a very good balancing of life and then enjoy
And especially
themselves.
if you enjoy your work,
Yeah.
and it is very evident from your responses that you really love the work that you are
Of
doing.
course I do. Yeah, I really enjoy my work, and that's probably why even my students enjoy studying with me, and we enjoy and grow together.
Definitely, definitely.
Yeah.
Thanks a lot. Thanks a lot for taking up your time, and I'm sure the audiences are being benefited with the vast information they have got through this. Thanks a lot. Thanks a lot,
Thank you
Doctor.
so much. Namaskar.